Thanks for joining us this morning. We're here with Public Health Director Jessica Guernsey, Health Officer Dr. Jennifer Vines, and Communicable Disease Services Manager Lisa Ferguson. Our speakers would like to talk a little bit about disease trends in schools and how schools and public health are working together to prevent the spread and investigate cases of COVID-19. So they'll say a few words and then we'll turn it over to you. And if you would at that point, just drop your name and the name of your news organization into the chat. We can take those in order. And now I will turn it over to Jessica Guernsey.
Thanks, Kate. Thank you, Kate. Julian, County Communications. My name is Jessica Guernsey. I use she, her, hers pronouns. I'm the Public Health Director at Multnomah County Health Department. Thank you for being with us this morning / afternoon so that we can provide a little bit of a level set on what we're seeing with schools as we continue through this global pandemic and addressing COVID-19. First of all, I really want to thank, obviously, our team and our staff. You're going to hear from Dr. Vines and Lisa Ferguson. Our whole entire team is really leaning in to supporting all the work to prevent the spread of COVID-19 in schools, but also keep kids in schools. These are two of our major public health goals right now as we pivot into full learning in classroom. I also want to thank all of the school districts and Multnomah Education Service District. This has really been an unprecedented Herculean effort to really do everything that we can to learn from what's happened thus far with COVID-19 and apply those learnings so that kids can get back to and stay in school. So we're going to talk a little bit about that today in terms of what we're seeing and what we're doing and how we're learning from that. It probably goes without saying, but I will say it. Seeing cases within the school environment is not unexpected. We're going to talk about what we're seeing right now, but it is not unexpected given that we've reconvened a very large group of people, many of which cannot yet be vaccinated. So youth under 12 cannot be vaccinated yet, although we're seeing some promising signs on the horizon for that to change, and we are planning for that. And we're also going to talk a little bit about what our local response has been. So you all will have an opportunity to ask questions, but really want to make sure folks understand what's happening on the ground and how we're refining that response work. So with that, I'm going to turn it over to Dr. Vines.
Great, good morning. Thanks, Jessica. Hi, everybody. Jennifer Vines, Multnomah County Health Officer. I just want to give a quick overview of COVID and kids. And I will start by saying that we've generally thought of kids as low risk for severe COVID, and that is still mostly true. That said, reports of pediatrics hospital surges outside of Oregon in the mid to late summer during the Delta spread, I think were a wake-up call for us that we have to take COVID in kids seriously. I have seen data suggesting that Delta is more severe in adults. Doesn't seem to be there so much for children. That doesn't mean it's not more severe in children, but the data seem to suggest it's more a question of just sheer numbers of children. And then that very tiny percentage that does get severely ill, potentially landing in a hospital at the same time. What we've seen in other states, best thinking is that it's a combination of enough infected adults, generally unvaccinated, who then mix with children who are unvaccinated, either by choice or because of their age and not yet being eligible, and then a surge that essentially includes all age groups. And that's particularly concerning because the pediatric hospital expansion plans rely on being able to use adult beds and extending the expertise of pediatric doctors. So when those adult beds are not there either, it's real cause for concern. So we've been watching this really closely. As we look at cases statewide, cases in young people have increased dramatically since July 2021, most of all in teens and then followed by the younger age groups. The same is largely true for Multnomah County, although with the 12 to 18 eligible for vaccine, we may turn the tide there. We are seeing relatively more cases among young people who identify as Black, African American, Native American, and Alaska Native, relatively more who identify as Hispanic ethnicity. And so that unfortunately is a reflection of the continued disease burden in those communities. When we start to look at Multnomah County, we see cases per 100,000, generally low compared to the rest of the state, but I would say we don't have a complete picture yet of the effect of Labor Day and the return to school. and all the mixing and socializing that has been happening over the last several weeks. When we narrow to age under 12, where by definition, no one is vaccinated because they're not yet eligible, we see a percent positive going from a low of about 1% in the middle of the summer to just over 5% in late August. And this group is generally not tested as much as others, so that can affect that percent positive number, but that mirrors the rise in cases that we've seen. An important thing for parents and families to know is that the majority of cases under age 12 do have symptoms. So 86% have symptoms. That is higher than the so-called pre-Delta era, where about 72% of youngsters had kids. And then luckily, hospitalization remains rare. So it's about 1 in 100 so far over the course of the pandemic. That appears to be the same for pre-Delta versus Delta. But I do have to acknowledge 3 pediatric deaths statewide since the beginning of the pandemic. Again, no age group is off limits as far as severe disease or worse. So we are balancing this risk with the overwhelming benefits of having kids learning in school in person, also knowing that kids mix outside of school. So with that, I'm going to turn it over to Lisa Ferguson, our public health nurse and communicable disease services manager.
Thank you, Dr. Vines. And as Dr. Vines said, my name is Lisa Ferguson. I am the Communicable Disease Manager for the Multnomah County Health Department. So I first just want to touch on the actual numbers, what we are seeing in schools so far this year. And then I want to talk a little bit about how the health department works together with MESD, the Multnomah Education Services District, and our school districts. So, you know, we, as Jessica discussed, we expect that we will see some cases in school because of the level of community-wide spread. We have seen around just over 100 actual exposures happen in schools. I think one thing that's really important to know is that numbers that we give right now are potentially even out of date. We're working very, very quickly. And so the numbers are kind of constantly changing when it comes to schools. We've had around 100 exposures in schools. That means we've potentially have exposed more than 1,000 people in schools. But I want to be really clear about what that means. If somebody is potentially exposed, it means that they could have come into contact with the person who's sick. It doesn't mean they've definitely come into contact. It doesn't mean they will definitely become ill. And what we do with the schools, I'll talk a little bit about what those numbers mean, the people exposed and those cases, and what we actually do with the schools to identify those people. I also think it's important to hear comparatively the total population in schools in Multnomah County. We have well over 100,000 students and staff. So our numbers are in fact relatively low as far as those number of exposures. What's most important though is even with the number of exposures that we've seen, we have seen very little evidence of any transmission happening within the schools. We do have, as I checked this morning, about 4 instances where we have common cohorts with multiple cases or student overlap in some way. And then we work to identify, is that something that actually happened in a classroom, on a bus, at another activity outside of school? So just want to be really clear that while we are hearing about exposures, we are hearing about people quarantining, the actual transmission that we're seeing in schools at this time appears to be relatively low. So in talking a little bit about how we do work with the schools in Multnomah County, we have a partnership with the Multnomah Education Services District and all of our district schools. We work very closely together, and really we're working to prevent transmission and to identify any exposures that have happened as quickly as possible. We also really emphasize layered mitigation in schools because we know that mask wearing combined with distancing, combined with ventilation, that all of those things together will reduce any transmission that happens among schools and in school-related activities. So there are some things that we really do focus on to make sure that we are identifying any high-risk opportunities and ways that we can mitigate those from the beginning. And so we've been working weekly. We've been meeting with MESD, we meet with school districts, and we look at our data locally. We look at national data related to schools, and we've come up with public health recommendations specifically for the schools. We also had to look at how Delta might change that and what things we need to alter in our plans. But we have provided pretty detailed operational recommendations. And then we talk through with the school districts to understand what barriers there might be to implementing those, how we can work with them. And, we've really seen school districts get creative and come up with things, painting circles, having for kids to eat lunch, really moving things outdoors as much as they can, and really getting creative to try to mitigate the risk of transmission in the schools. And so then we provided recommendations to the schools. Some of the things that we talked about specifically are like lunch and how to safely have students eat lunch, because they're unmasked and maybe close together in cafeterias, we've asked them to move things outside. We're looking at options for, when it's colder and tense. We've provided a lot of recommendations around activities like band and choir that might be special circumstances. We've also provided a lot of recommendations around sports and how schools can still safely have some of those extracurricular activities while protecting the students and staff. I also want to just mention how we work with schools when we have a case or outbreak. So typically a parent would call and let the school know about a case. There are also avenues that the health department, legally, all cases are reported to us. And so we may also identify an exposure in a school when we talk to a parent. And so once the school is aware that there was somebody there who could have been infectious, the health department and the school nurse and MESD work together to determine what exactly was the time period that person was sick. Was it while they were at school? If so, then MESD nurses work very closely with the school to try to pin down those very specific activities. What bus were they on? What classroom are they in? Talking to the teacher to determine, are students wearing their masks consistently in that class? What kind of spacing is happening in that class? Are we able to just exclude the students who are sitting very closely? Do we need to look at a whole cohort quarantine because mitigation measures weren't in place? And so we go through all of those details and try to determine who was exposed, and then provide recommendations around quarantine for those people who are exposed. And then the school will actually communicate to people to let them, individuals who are exposed, know they receive a letter. Schools are trying very hard to also do phone notifications. It's really challenging with the number that they're dealing with. And then they also send a letter to the entire school community to let them know that an exposure occurred. So anyone who is individually exposed will get that separate notification that they should quarantine, or that if they're fully vaccinated, they can provide that information to the school and not necessarily quarantine. And then our team at the health department, we have a specific team for schools that anytime we suspect that there might be spread that's happened among students, among a cohort, then we really look at how can we prevent that transmission from happening anymore? Do we need to do a larger cohort exclusion? Do we need to put additional mitigation measures into place? And we'll open an outbreak if we see spread among a cohort. So that's sort of our general flow of how we're communicating and identifying those exposures. So I will stop there.
Thank you all. We will start taking some questions, and perhaps we could start with Morgan Romero at KGW. I think you had some questions.
Yeah, can you guys hear me okay? Awesome. Yeah, so I have a few. I'll try to start with kind of the most pressing after listening to your briefing with commissioners. One thing that was discussed at the end was testing, and you mentioned PPS program with OHSU. So it sounds like commissioners and public health agree, testing is the key to minimizing school disruption and keeping kids in school, but also the other public health goal of, limiting transmission. So is Multnomah County doing anything, or is there anything that you guys know Oregon Health Authority is doing to ensure that tests are more accessible and available to people? You go online right now and there's limited at-home tests, or the prices have just become exorbitant. So how are you guys working with families or just the average person or school districts, all the above, to ensure that tests are accessible and available?
Can you hear me okay?
Yes.
I'll chime in a little bit from the sort of health department side, and then Lisa, if you want to talk a little bit about the school's testing work that you mentioned in the board briefing. So we just expanded our testing availability through our community testing site on Tuesdays through public health. OHSU has also reinitiated their testing, some of their testing access points that they had previously earlier on in the pandemic. So we have tried to stretch the resources as much as we can. The challenge, I will say, across all systems, public health, our clinical services, healthcare and hospitals, is staffing. So we continue to struggle with that. That being said, we're continuing to balance the vaccination and testing access for more the community test sites. At least I don't know if you want to talk a little bit about the school testing.
Sure. Just to make sure everyone hears that there are some testing options available through schools. There is an OHA and OHSU combined, and this is with Portland. Portland Public Schools has opted in, and other schools in the county may have also opted in, but a school opts in, and then families in that school can choose to do a weekly screening for their students. And so they would get a test kit at school, bring it home, do a swab, bring it back to school the next day. It goes to OHSU for testing. Parents receive notification via email. And so that is something that's available for weekly screening. Schools also have testing. If students become symptomatic on site, there is testing available for them that way as well. So those are the testing options through the schools.
I guess my question is, are there enough tests though to ensure that there's minimal school disruption?
I mean, we're always, like I said, we're looking at the balance. Right now we're challenged, like I said, that's why I mentioned the staffing on every front. I don't think testing is not the only pathway in terms of continuity of education and keeping kids at school, What Lisa talked about in terms of our work with the guidelines that the schools have been working really hard on have been absolutely key in helping to minimize kids having to quarantine. So the other piece that plays into that is vaccination. We're continuing to focus our efforts on under-vaccinated geographic areas in town and with communities to make sure that folks have access to that. So, arguably, we don't have enough of anything right now. The way resources are stretched, especially with staffing, is particularly challenging.
Thank you.
Thank you. And I think Isabella Garcia with Portland Mercury, you're next.
Thank you. I was just curious, if we could get a bit more detail on what would cause schools to go to remote learning. I know Dr. Vines, you mentioned earlier in the board meeting that it's difficult to determine an exact threshold for a public health school closure, just because, those kids are still going somewhere. There may be community spread when you close the school. Could we get a bit more detail on what you're looking for when you are weighing those things? Are you, what is that, a metrics thing? What would cause, on a case-by-case basis, when you're looking at schools, what would cause a school public health closure?
Sure, thanks for the question. We have heard clearly from school leadership, from parents, from the public, that they are looking for, like, what is that mark where schools are no longer safe for kids to gather every day. And I think they imagine, a number of cases or a % positive or some level of transmission. We have really grappled as the local public health authority with this question, knowing that people want to know what to expect. And we struggle with it for a few reasons. The first is that we want kids in school. And so we can talk about closing a school for public health reasons, but that's not going to keep kids from mixing. And if anything, they're better off in school for the learning and in a structured environment where people are reminding them to wear their masks and to stay apart. So that's part of what we're struggling with. I think we saw an example recently with Reynolds High School where it becomes an administrative decision to go to distance learning. My understanding from their school leadership is that they simply didn't have the staff to notify hundreds of families, almost a third of their, I think, high school, of the need to quarantine. And so rather than dialing all those numbers, they closed school for 2 days and prepared for distance learning. The other reason being that they didn't have enough teachers to manage online for a third of the school and then in person for the other 2/3. So that was not a public health decision. There is not an outbreak at Reynolds. That was an administrative operational decision. And the way that we are so pressed for staff in public health and in schools, that may be the more likely scenario, but we continue to grapple with the public health threshold. And I think, frankly, it boils down to family confidence in sending their children to school and feeling like schools are taking COVID seriously and managing the precautions. I think so far we've been really lucky to have school districts that have just been amazing partners and really willing to put in place as much as they can, knowing that our return to school coincided with probably the worst timing in the pandemic.
Thank you so much. Rachel Monahan at Willamette Week.
Hi there. You mentioned maybe 4 schools in this briefing and 5 when you're talking to the board that have multiple cases within a cohort, meaning potentially spread in a school, if I understand correctly. Can you tell us what schools those cases are in and what, as of now, you believe are some of the possible protections that were not working or were not being implemented in those cohorts as effectively as necessary?
Yeah, we're still investigating that. I can't really speak to those details right now because, that's something that we have to work closely with the school. And honestly, we may not always know that level of detail. And so we do try to find that out, but what we're most concerned about now is making sure that that spread doesn't continue. So identifying, was there a breach in a classroom? It is important, but we also need to look at, sometimes is it best to quarantine an entire cohort if we're seeing spread. So those are the things that we continue to look at. But I don't have specifics on each of those situations to say, in this situation, we think this happened. In this situation, we think this happened. It can be really challenging to drill down to that. Do these students know each other outside of school? Did they, have an encounter here? And so sometimes we don't get to know that level of detail.
No problem. Can you share which schools though, please?
I honestly, I don't have the names right off the top of my head. I think that the best way to understand schools that have that transmission is the OHA weekly outbreak report. They are now linking those to show that the schools on the outbreak report are the ones who have some kind of transmission identified. And so I think that is really the best place to get that information because it's a consistent weekly report.
Rachel, we're happy to follow up with you. We're happy to follow up with you.
I have a question. So just to be clear, you are declining to release the names of the school because you do not think that that's public information or worthwhile to put
Rachel,
out?
I think,
please explain that.
Rachel, I think Lisa already answered your question. So we're happy to follow up with you after this if you'd like to talk about that more. But
she did not answer the question.
We have quite a few people who want to keep asking some questions. So why don't we just circle back with you after that?
That was a simple yes or no. Are you going to release that information to me on which schools have
We're not going to release that to you right now.
Okay, thanks.
Courtney Vaughn, Portland Tribune.
Hi, yeah, thank you. During your earlier session this morning, you guys mentioned the quarantine protocol, and as I understand it, if there is a possible exposure, a student would be quarantining for about 10 days, regardless of whether they have tested negative. Is that the sort of the protocol across the board? Do you guys advise schools on how to carry that out? Because we've heard parents say, my kid was potentially exposed, had to quarantine, and even though they tested negative, still were not allowed back in school. So I'm hoping you can just reiterate what the recommendation is there.
So in general, there are a couple ways that the quarantine can happen if somebody is exposed. By CDC and state guidelines, there is a 10-day quarantine option, a 14-day quarantine option, and there is an option for a 7-day quarantine where somebody gets tested between days 5 and 7 and then can release from quarantine if they have a negative test and in that window of time. In general, in Multnomah County, we have not adopted that test out option, and specifically in schools, we have not adopted that mainly because of the equity focus that we have concern about everyone having access to that 5 to 7 day testing and the challenges for the schools to track that. And so that is not a general recommendation that we have made. But again, as we discussed in the board briefing, I think we are continuing to look at increased access to testing for students so that we can look at that as an option. Ideally, we would like to be able to offer that as an option, but we also need to ensure that there's adequate access to testing for everyone to partake of that.
So to clarify, is it 10 days recommended quarantine or 14? Is there sort of I'm not sure what the number is.
Yeah, it's 10 days in Multnomah County is our recommended quarantine.
Thank you.
Lisa Balick?
Yes, hi, thanks. Question I have is what's keeping the county from keeping a record of vaccinated students? And again, even on a voluntary basis, and will you look at changing that, allowing people a place where they could record whether or not their student or the student themselves says that they are vaccinated? Clearly that would help in the tracing situation.
Yeah, I can comment a couple things on that. So, some of the school districts are asking for that information voluntarily from parents so that they can track it because, I think as was explained in the briefing and today, this is a joint effort between the Multnomah County, Multnomah Education Services District and the school districts. And so, we do have access to the state immunization registry, but the practicality of saying, here's a list of 100 students, okay, hand look up each of these students. And so often the school districts are doing that legwork. They're asking for that information from parents. Parents are providing it directly to the school district. And so I think, there are certainly, we have other access for school required vaccines that we as the health department can easily ask if we know there's an exposure. A school district can pull that out of Synergy, hand us the information, we can see who's been vaccinated and who's not. So in other vaccines, we do have access to that information. We know that school districts are trying hard to collect that and to allow students to not quarantine if they've been vaccinated. So I think that's one that we continue to work through how to make the system more efficient so that we can minimize the students who are outside of school.
Thank you, Lisa. Erin Ross, OPB.
Hi, thank you. Just very quickly, so the weekly outbreak report, is that just compiled by OHA, and does Multnomah County compile their own information on outbreaks?
So we use a state database for all of our disease tracking, and the OHA weekly report is pulled out of the information that we enter into the state database. And they, in the past, had been reporting on their list every, I think they're still doing every single case in a school, but the outbreaks have now been updated to be, the outbreaks are listed as where there is some kind of transmission identified versus just having every single school listed as an outbreak. And so that is our data that then is fed into the state database and put out in that weekly report.
And does Multnomah County have any plans to make their data available sooner than that report, or to release it on a more updated schedule, like when you identify an outbreak?
Not at this time.
Mm-hmm. Okay, and then my other question is Multnomah County keeping track of school adherence to these different guidelines? Since they are guidelines and all the schools are kind of interpreting them differently, I've been hearing from a lot of listeners that we've got just huge variation in what different things schools are practicing. So does Multnomah County keep track of that in any way?
I can jump in. I would say we work with our schools. It's the group that we are working the most with right now in all of this work. And we are meeting with them regularly, multiple times a week, to check in on what their barriers are to implementing the public health recommendations that we've made over the last few weeks. We are tracking it in that we have conversations with them every week about how to improve the uptake of those recommendations. I think Lisa and Dr. Vines mentioned the amount of creativity that people are utilizing to meet the recommendations is amazing. But we're really in a partnership with them. So it's tracking in that we're working with them on it, but we're not going out and checking on it every day or every week. We're meeting with them regularly to talk through what the barriers are and help facilitate conversations to make as much of it happen as we can.
And what sort of barriers do you see? And that's my final question.
There are all sorts of barriers. I mean, obviously it doesn't, I mean, you don't have to work in a school to imagine the amount of situations that can arise with youth, coming in contact with one another. So one thing would be space, just the amount of space that a school has, access to different tools that people can use to allow for lunch outside. So for example, if a school plans to have lunch outside, ordering tents, we've been facilitating with ordering structures for folks, and then just the communications to families and youth, making sure that there's adequate communications. There's been a bunch of questions on this call and then at the board briefing as well regarding fine tuning all of this. And just one thing that I will say is that we're still at the front end of this. We're very early in schools reconvening in full. And I would say, for the next 6 to 8 weeks, there's a lot of deep learning that we're planning on doing to help mitigate the spread and again, keep kids in school. But we're in a very iterative learning process right now. Like I said, this is the area that we're spending the most time on to really understand what's going on so that we can modify and support the schools.
Thank you.
So much. Keely with K2.
Hello, thank you so much for taking the time today and answering our questions. I have just 2 questions. One of them, some districts, including Reynolds, who is now doing distance learning, as you mentioned, is reporting that they don't actually have the space to do the 3 feet of distance between students, which has now led them to needing to quarantine hundreds of students. How can situations be prevented let me start that over. How can situations like this be prevented if the spacing doesn't allow 3 feet or more?
Well, I think that's what I was just talking about. I mean, there's multiple situations and different approaches that we've been working with on schools to help either provide outdoor space to spread people out or different considerations on the ground for each different school. So it's highly variable depending on the situation. And Lisa, I don't know if there's anything specific in the Reynolds situation that we could speak to.
Actually, I'll jump in here and say physical distancing is probably the weakest preventive measure. So good ventilation, masking, vaccinating everyone who's eligible, those are actually stronger. So yes, we have to follow guidelines around a definition of exposure, and that unfortunately leads to a situation like Reynolds. From an actual disease transmission risk, my hope is that would not be a deal breaker. And now I'll give Lisa a chance to comment.
Yeah, I don't know that I have anything more of significance to add. And I think to Jen's point around vaccine, that is definitely an important piece. And we will continue to see as vaccine is available for younger folks, that is another avenue to help us avoid those large quarantines. So I think that will be important.
And then my last follow-up question, I think the thing that has struck so many people, and you guys even mentioned it here, is that in the Reynolds School District situation, we're talking about just a few students who have tested positive, but now hundreds of students who have to quarantine, and that's enforced this entire school to go to distance learning. Is that right to be making that kind of disruption for all of these students for just a few, less than a handful of cases?
So I'll chime in and then Lisa and Jen, feel free to jump in. I think this situation is a reminder of where we're at and how we're going to be making decisions going forward and supporting schools. Certainly, I think it's given us information to support schools in implementing seating charts and other public health recommendations. This is why we do that, and it's very complicated to do. We're overlaying a whole system on top of the difficulties of, in-person classroom learning after, quite a long time. So I think that I think it's the right decision. As Jen said, it was an administrative decision, not a public health decision. And we are leaning in to provide additional support so that we have less situations like that and our quarantines can be tighter and tighter, if that makes sense.
Thank you.
Thank you. Bridget Chavez, KPTV.
Yeah, thank you again for taking the time. I'm wondering if you could explain to parents the differences in quarantining rules from buses to classrooms, and just how these, I guess, these recommendations are put in place. And again, just the challenge with buses that poses, because kids are literally sitting right next to each other in a confined space.
Yeah, I can talk a little bit about those differences. So we do have a new definition this school year from the CDC around exposure that allows for, in controlled environments like a classroom, that we can quarantine only those children who are within 3 feet. Typically, we've always said 6 feet, but in those controlled academic classroom settings, data has showed us that students are not as likely to transmit COVID. A bus is a little bit different. We still use 6 feet in a bus because kids are not as stationary. They aren't necessarily sitting the whole time. One of the biggest challenges we find with buses, I think we've said this already today, but it's staffing. We know there's a shortage of bus drivers. And so the expectation for a bus driver to be able to safely drive a bus and see everything that's happening, whether every student has their mask on the whole time, if they've moved, how close they are to each other, is very, very challenging. And so that has led to some of the bus exclusions being larger because we don't have a seating chart in place, or somebody's not able to say that the mitigation measures were actually in place. So there is a little bit further distance if we are able to identify close contacts on a bus. And then if we aren't able to make that close contact identification, it has resulted in some of our larger exposures on those buses.
Okay, so can you speak to what it would look like for a student that's exposed on a bus, what their quarantine amount would look like compared to someone in the classroom?
So it would still be a 10-day quarantine. They would have the same quarantine period. And, I think that the transmission risk change on the bus is just with the potential movement that's happening and the students constantly coming in and out, as opposed to the controlled classroom environment. So anyone who's deemed exposed still has the same 10-day quarantine as anyone else. It's just that sometimes on the bus, we end up with those larger exposure groups. I think one thing as Jessica spoke to, we're sort of still in a learning phase. So I think one thing we'll be looking at really closely is on those larger bus quarantines that have happened, how many people did become sick, and that's something that really then tells us, do we need to continue to do larger quarantines? How can we adjust that process to really focus on the true risk?
Right, and I'll just chime in. Yeah, I'll just chime in that we're going to have that local learning. We also have essentially a nationwide several experiments going with COVID in schools. That's how we got to no quarantine in classrooms if kids are masked and 3 feet apart. That's based on a study. So I do expect things to change. I don't think anyone here would argue that it's perfect right now, but it's the best we can do, again, during a very delicate time as far as the pandemic and schools are concerned.
Thank you. Fedor, Oregonian.
Hi, thanks for taking my question. So I was talking with Stephanie Field at the Reynolds School District, and via email, she essentially said that the school closed for a week to allow the school-based administrators the opportunity to collaborate with operations, risk management, transportation services, nutrition services, and other departments to put in protocols to lessen the impact to quarantine in the future. So my question is, why wasn't that work done ahead of time? Like, why does it appear to have come as a surprise that it might have been necessary? And will other schools also do put in these kinds of measures after their large quarantines, or will they also have to close for some amount of time to put them in place?
Well, I can assure you that Reynolds has been at the table during all of these conversations. I think the reality of implementing these to scale with the amount of kids that are coming back and the different facets that are required to planning, be it lunch, sports, choir, performance in classroom are really staggering. I can't emphasize enough how much work this is. And I feel very blessed that we have partners in our school districts that are really taking this seriously and trying to implement as much as possible. And it's a really heavy lift to ask people to engage in. So it wasn't that it was a surprise, it's the extent at which we have the interface of what those recommendations are vis-a-vis actual things like I was talking about seating charts and making sure those are fully implemented across the board so that we can shrink the number of people down. I think, for better or for worse, like I said, this is a harbinger of where we are right now and what the impact could be to continuity of school operations, not so much disease transmission, but that's the kind of thing that we're working with the schools with on a daily basis to refine. So it's not that anybody dropped the ball, it's that the reality of implementing those different structures and recommendations are a really heavy lift.
Thank you all for joining us this morning. If people have follow-up questions, please feel free to email me and Julie. And also, if you didn't tune in this morning to the board briefing, there was a lot of really good information in that, some crossover. So check that out. And thank you all again. Be well.